Hey everybody, welcome to MedPod Today, the podcast series where MedPage Today reporters share deeper insight into the week's biggest healthcare stories. I'm your host, Rachel Robertson. Today is actually a milestone for MedPod Today. It is our 50th episode. Thank you so much for all of your support and views over the past 2.5 years of our little show. To kick things off today, Jody McCreary will tell us about the revolving door leadership at NIH's Institutes and Centers. Then Cheryl Clark will fill us in on her reporting on United Healthcare's controversial new policy. After that, Christina Fiore will tell us about a bill that would erase 2 decades worth of certain types of state nursing board discipline. The NIH is made up of dozens of centers and institutes, but at many of them, the revolving doors are spinning. That's because a surprising number do not currently have permanent leaders. MedPage Today reporter Jody McCreary took a closer look to find out why. Jody, how many are we talking here?
Well, Rachel, there are 27 centers and institutes that make up NIH, and I found 16 either have an acting director or no director at all. Now, here's how that breaks down. The NIH directory shows 14 centers with acting directors, and 2 of the permanent ones still show up on the list even though they've left. Back in December, Walter Koroshetz was removed as director of the National Institute of Neurological Disorders and Stroke. Then, earlier this month, Lindsay Criswell emailed her staff to say her contract was not being renewed as director of the National Institute of Arthritis and Musculoskeletal and Skin Diseases. Now, there's even turnover among the acting directors. Allison Cernich was the temporary head of the National Institute of Child Health and Human Development, but she's leaving too, to go work for the Shriners Children's Hospital System.
What's the reason for all of these moves?
Well, we know the Trump administration wanted a lot fewer institutes and said it wanted to consolidate those 27 into 8. The president also proposed massive cuts to the budget, but Congress stepped in and rejected that. NIH is being funded at about the same level as it was last year. Now, it's easy to connect that to what's happening now. And when I put that question to an NIH spokesperson, they didn't give me a straight answer. But an expert I spoke to says making that link might not be fair. He says both sides in Congress know NIH funds valuable medical research and wants to keep supporting it.
Okay, let's pull it back a little bit here. In the big picture, what are the implications here?
Yeah, it goes back to one key issue. If you think about the scientific priorities for each center and each institute, it's the directors who are responsible for turning those into funding decisions. Now, they play a big part in determining which research projects go forward. So the people who have those jobs need to be both scientific experts and skilled administrators. And that puts a lot of attention on the process of filling those positions. It's why there were so many questions about the hiring of Kyle Walsh as director of the National Institute for the Environmental Health Sciences. He does have strong scientific credentials, but he also has personal ties to Vice President J.D. Vance, who officiated his wedding. Now, as a result, the scientific community is keeping a close eye on how these other directors are being picked.
Thank you so much for your reporting here, Jody.
Thanks, Rachel.
United Healthcare is the nation's largest provider of Medicare Advantage plans. But a new policy that takes effect May 1st will affect doctors in most states and will likely lead to physician angst and patient anger and confusion, and possibly even delays in care. Cheryl Clark is here to tell us more. Cheryl, United Healthcare seems to always be making headlines and often not in good ways. What is going on now?
Well, it has to do with a new referral policy, Rachel. Up until May 1st, enrollees in United Healthcare's point-of-service and HMO plans in 37 states have had coverage for in-network specialists' care. But the new policy will require enrollees to first get a referral from their primary care physician. The problem is, currently, a lot of enrollees don't even have a primary care physician because their healthcare needs have been met by those specialists. And as we all know, PCPs are in very short supply in many parts of the nation. As a personal note, I'm in San Diego, which has an awful lot of primary care doctors. but I had to wait 3 months to find a new one after my internal medicine doctor retired last year. So it's a common lament. Now, if the enrollee already has a primary care doctor, the referral can be requested on the basis of an email or a phone call. Doesn't really need a face-to-face visit, but it still can be a tough step to go through and more work for the practice.
Your story was one of the top reads on the site in the past couple days. Why do you think there was so much interest in this topic among our readers?
Well, it's probably money, right? That's usually the answer. Because the specialist will be on the hook for the visit if care is provided without that referral. Claims will be denied. Here's a quote from United Healthcare's notice about this new policy. Quote, claims denied due to missing referrals will be considered provider liability. It's important to note that many types of care are exempt from this policy, like OBGYN, emergency medicine, mental health providers, and oncologists. No primary care referral is necessary, but there's a wide array of specialists who will now require one. Rheumatology, gastroenterology, cardiology, endocrinology, otolaryngology, orthopedics, urology, neurology, and on and on. And by the way, this is not all that new for some states. United Healthcare has been requiring these PCP referrals in Florida, California, Texas, Illinois, Missouri, and Nevada. They've learned to live with this, and they make sure the referral gets filed. A scheduler's phone call or electronic messaging with the primary care office is part of the process days in advance.
What's been the reaction to all of this, and why is United Healthcare doing this at all?
Well, from our comments and my reporting, it appears that specialists aren't too happy. The policy says the patient cannot be balance billed, so they are going to absorb the cost. I can imagine this is going to lead to some awkward and maybe some angry encounters for patients who show up and are caught by surprise. And about why United Healthcare is doing this. Consumer advocates like Wendell Potter, you remember he's the health plan whistleblower, says the reason is to reduce payments to physicians because United is under the gun to improve their earnings. Others imagine the health plan will find a way to pressure its primary care physicians to go slow and maybe deny a patient's request for referral if the PCP can be persuaded it's not really necessary.
Thanks for your reporting on this, Cheryl. In Kansas, a bill that would erase 2 decades worth of a certain type of state nursing board discipline is gaining momentum. The bill passed the State House of Representatives last week and will now be considered by the state Senate Health Committee. Christina Fiore is here to tell us more. Christina, can you start by explaining what's in this bill?
Sure. So HB 2528 was only introduced in late January, and it just passed the House by a margin of 88 to 34, so it has a lot of support. The bill calls for several changes, but key among them is erasing 20 years worth of disciplinary actions for late license renewals. That sounds dramatic and astounding, but that's what it calls for, 20 years worth. It would also establish a pathway for late license renewal so that nurses won't get dinged for unprofessional conduct for forgetting to renew their licenses. It also calls for a host of other things, including requiring digital reminders about license renewal, limiting the term unprofessional conduct to practice-related issues, and prohibiting retaliatory action against licensees.
Why does this bill have so much support?
It seems that a lot of nurses have had run-ins with the Kansas State Board of Nursing around this late license renewal policy. I spoke with one nurse who had this problem. Her name is Amy Seipel, and she said her own experience drove her to address the policy head-on when she was slapped with unprofessional conduct for being late to renew her license just one time. This happened one time out of 30-something years in practice, she told me. She had temporarily stepped away from her career to take care of her husband, who had cancer, and when she wanted to come back to work, she realized that her license wasn't active. She thought it would be a simple late fee and that she'd get her license right back, but she said instead she was hit with unprofessional conduct, and she's been fighting that ever since. So there were 2 hearings with the state's House Select Committee on Government Oversight last summer, where Seipel and many other nurses described their experiences and how they felt this was really unfair. And then in January, the bill was introduced. Seipel thinks it has a really good chance of passing the state Senate and making it to the governor's desk.
What does the Board of Nursing think of this?
I reached out to them, but they didn't respond to me. And I found some other stories about the bill. And during one hearing on it, the board's executive administrator, Carol Moreland, raised concerns about some of the cases that would be voided under this bill. She said one of those cases was a school nurse who had sexually inappropriate relations with students, and one of them was a nurse who stole credit cards and made purchases after a patient died. However, proponents of the bill told me they insist that only discipline related to license renewal will be erased, going back 2 decades.
Well, thank you, Christina, and it'll be really interesting to see if this passes and becomes state law in Kansas.
Yeah, we'll definitely be following it. Thanks so much, Rachel.
Before I let you go, a quick update on the spread of measles. There were 104 new cases last week. The week prior saw 146 new cases, and the week before that, 206. The US has already surpassed 1,000 measles cases this year. Florida has seen some outbreaks tied to college campuses, and Utah has a new outbreak tied to the Utah State High School Wrestling Championship. South Carolina and Arizona also remain hotspots. You can get a more detailed look at measles spread each week with our map linked here. And that is it for today. If you like what you heard, leave us a review wherever you listen or watch, and hit subscribe if you haven't already. We'll see you again soon. This episode was hosted and produced by me, Rachel Robertson. Sound engineering by Greg Loud. Theme music by Palomar. Our guests were MedPage Today reporters Jody McCreary, Cheryl Clark, and Christina Fiore. Links to their stories are in the show notes. MedPod Today is a production of MedPage Today. For more information about the show, check out medpagetoday.com/podcasts.